Hello. The newspaper article on mental health I'm going to talk about today was published in the Financial Times on Friday the 7th of August. It's entitled Mental Health Should Have Priority Over Railways, and it was written by Richard Layard, who directs the Wellbeing Programme of the London School of Economics Centre for Economic Performance. I'm Dr Beth Colby. I'm a psychiatrist in London. In this article, Richard Layard argues that instead of build, the government should prioritise funding mental health care services. He said that the post-COVID spending priorities for the government should be based on what would do most for people's well-being, and that the test for this would be how much each pound spent would increase this. Richard stated that the highest value for money comes from treating mental illness. Mental illness is the main illness of working age and accounts for half of the morbidity and half of the absenteeism and disability. When people recover from mental illness, they can go back to work, pay taxes, and thus not need to receive benefits. The savings from the NHS's flagship service, the IAPT, which is IAPT, Improving Access to Psychological Therapies, has already covered its cost. However, fewer than 1 in 5 people who need psychological therapies receive them, even though they are effective and inexpensive. Due to the massive backlog of untreated physical health problems due to the COVID-19 pandemic, the NHS long-term plan for mental health is under threat. And the temptation is to take funding from mental health to fund physical health interventions. Due to lockdown, it has been shown that digital methods can often produce good results in treating mental illness and so need less money. So the temptation again is to take the money from mental health. However, treating mental illness is crucial to improving physical health conditions, and this has been shown to be the case for diabetes, heart disease and lung disease. Richard Layard argues that if psychological therapy costs go down due to technology, the money should go on treating more people with psychological needs, and I quote, the army of mentally ill people. He says, of course, that money needs to be spent on physical health care, but not at the expense of mental health care. The World Health Organization calculates that mental illness accounts for 25% of the European burden of disease. However, in England, only 14% of all health expenditure is spent on mental health, and this needs to increase. According to the all-party parliamentary group on Wellbeing Economics, wellbeing should be the #1 priority for the next spending review, and there should be a separate health budget, rising twice as fast as that for physical health, for both adults and children. For adults, the improving access for psychological therapy service is behind target, and that is because clinical commissioning groups have not committed to employing the personnel needed that was included in the NHS long-term plan. The health service also only treats a small fraction of the 1 million people who are addicted to alcohol, drugs and gambling. For children, the new school-based service for distressed young people covers only 1/5 of England and should be rolled out much further. Richard urges his readers to think straight. He said, and I quote, "Which is more important, to help our children, relatives, friends and colleagues who are in terrible mental distress, or make a small improvement in the rail journey from London to Birmingham?" Richard concludes by saying that our social infrastructure is much more run down than our physical infrastructure, and we need to repair our system of social care, children's services, further education and youth, and the physical part of the NHS. But above all, he says, let's think about age-old injustice to people in mental distress. We have good treatments now. Let the people have them. Thank you for listening. Bye.